Hello, I'm Dr. Amit Desai. I'm a surgeon and I take lectures for FMGE as well as for NEET PG, mainly in surgery, but also in anatomy and physiology at times. So let us get to the next MCQ in our series, MCQ for you. All right. Let us see what the question is. Now, a 20-year-old female, all right, presented to you with a thyroid swelling. Now, you did a fine needle aspiration cytology. And what is it that it will not be able to diagnose? We want to know which of these cancers cannot be diagnosed by a fine needle aspiration cytology. All right. So, what are the options that they've given? Papillary thyroid cancer, medullary thyroid cancer, non-Hodgkin's lymphoma, and follicular carcinoma of the thyroid. So, what do you think is the answer? Yes, the answer is follicular thyroid cancer. Okay, because FNAC cannot differentiate between follicular adenoma and follicular carcinoma. FNAC cannot differentiate between follicular adenoma and follicular carcinoma. You need a biopsy for that to know the vascular invasion and other characteristics. And hence, follicular carcinoma is the answer. Now, if you see papillary carcinoma, what will an FNAC show us papillary carcinoma? So, first and foremost, as the name suggests, it will show papillae or pseudopapillae formation. All right. Papillae or pseudopapillae formation. All right. Next thing is that these papillae which are there, they outgrow their blood supply. But because they outgrow their blood supply, you will see dead cells, which do not receive nutrition at the tip of papillae. What are these dead cells? These dead cells are called as Samoma bodies. They are called as Samoma bodies. Another thing that you will see is the characteristic of the cell. The cell has a large nucleus, dense nucleus with a clear cytoplasm. So it looks like the eye of a cartoon character called as Orphan Annie. So these cells are called as Orphan Annie eye cell. Okay, so these are what you will get. The nucleolus will also show something called as pseudo inclusions. Pseudo inclusions, right? Then we come to medullary carcinoma. Medullary carcinoma, if you do an FNAC, what will it show you? Medullary carcinoma will show you the presence of amyloid stroma. Very important, asked in the examination, amyloid stroma. Okay, so medullary carcinoma will show you the presence of amyloid stroma. Okay, so this is what you will get. Okay, in papillary carcinoma, medullary carcinoma, but in follicular carcinoma, you will not be able to differentiate between the follicular adenoma and follicular carcinoma, and hence you cannot do an FNAC for diagnosis. All right. So this was about our MCQ for today. All right. If you liked it, please subscribe to our channel ADSL Academics, like the video and press the bell icon so that you get notification for the other videos. Thank you very much.